going to talk about something you may have heard a lot about but may not know exactly what it is: sleep apnea. It's a very real problem that affects thousands of people trying to sleep every night. And today, Dr. Mark Jansen from Baptist Health is here to explain the symptoms and, more importantly, how it can be treated. Good morning.
Good morning. How are you?
Yeah, tons of people are suffering from sleep apnea. Apnea, maybe they don't know it even, right?
Right. It's a problem that is very much underappreciated. 1 out of 5 folks may have mild apnea in the United States. Say anywhere from 10 to 15% may have the problem. As far as the condition, sleep apnea is a problem where an individual at night is trying to sleep. They're trying to take a breath in. The lower airway will collapse, and they're attempting to get air into their lungs, but they can't. And if you have this episode to occur 5 or more times in an hour, we would then say that you have sleep apnea.
Okay, so they're just not getting oxygen during the night.
Correct. They're making the attempt to breathe, but the air is not going into the lungs.
Okay, what are some of the signs we see then?
Well, snoring is probably the most common thing, and it's snoring in the absence, snoring trying to get air in, and then having a problem with pauses in breathing, gasping or choking during sleep. You'll alert yourself. You just wake up and kind of sense that your partner in bed may recognize that as well.
Right, yeah.
Restless sleep. Urinating at night frequently. So somebody gets up several times a night to urinate. We won't go into all the technical details, but that person may have a problem with sleep apnea.
Okay.
Headaches in the morning. You're attempting to bring air in through your airway, and that can create a headache that you have. And then, very importantly, that you have excessive daytime sleepiness, that you're not getting restorative sleep.
So you said it may be the partner who tells them that they've got some of these symptoms.
Yes.
How do doctors screen for it, though?
Well, there are 2 ways to screen for sleep apnea. One is that the simpler method is to do what's called overnight pulse oximetry, and the words are technical, but basically you get a gizmo on your finger or your ear, you go to sleep, it measures your oxygen level during the night, and if you quit breathing, obviously your oxygen level will drop off, and we can actually measure that then on a graph overnight. The better test, the precise test that really gives us a diagnosis, is called an overnight sleep study. You get your teddy bear and your toothbrush, you go to the hospital, you spend the night. They basically are monitoring your oxygen level, your heart rate, and they can get a lot of good information from that study to determine if you have the problem.
From what I understand, it's a good night's sleep when you're even there, even in a strange place. They make it very comfortable.
They make it very comfortable, and the other thing is that if an individual has the problem, as soon as they start to administer a therapy, which we'll talk about in a moment, they may actually get one of the better nights of sleep they've had in quite some time.
Yeah, they may go ahead and put on one of these devices. All right, let's talk about the treatment and the machines that you have here.
All right, well, there are several treatments for sleep apnea. One is to what's called positional therapy. That would be where we talked a moment ago about tennis ball shirts, where you can have tennis balls in a shirt, and it forces you to sleep on your side. And it's those who know somebody who snores, that if you're on your back, you snore more. If you get on your side, you don't. So that would be positional therapy. Weight loss, whether that's achieved through dieting or through bariatric surgery. Avoiding alcohol and sedatives, anything that causes you to be more sedated when the airway closes off. It makes it more difficult to arouse from that deeper level of sleep, to wake back up, to start breathing again. There are oral appliances. You can put something into your mouth that pulls your teeth, your lower teeth forward, and that opens up the airway in the back of the throat. CPAP machines, positive airway pressure machines, which we'll talk about, and then finally surgery. The surgery could be anything from removing tissue on the back of the throat. It could be bariatric surgery to help somebody with weight loss. And then in extreme cases, a tracheostomy, where they'll actually do an operation. This can be very much a life-threatening problem. So that sounds extreme, but individuals may require a tracheostomy to bypass the area of the throat that collapses to get air into the lungs.
We've heard cases where people simply didn't wake up sometimes.
But the standard therapy, CPAPs, we have Beth here, Melinda here, Barry over here.
3 models here.
3 models.
Right.
Right, and there are a lot of folks out there that have CPAP machines that they tried to use and then quit. And one of the things we need to know is that the technology on this has changed. Some of the appliances to actually put air into the airway are getting much more not near as obtrusive, with little nasal pieces here. Some masks will cover the nose and leave the mouth open, and in a more severe case, you might have to have a full facial mask, as we have here. The machines are not obnoxious. I just turned this one on. It's now running. You can tell it doesn't make a lot of noise, so it's not really going to interfere. Some people actually like the white noise of the machine. I think it helps with sleep. And the final thing I want to say about the machines, when you inhale, the air's going in. When you try to exhale, the older machines push back against you. The more modern machines like this one, this is a Respironics machine, and it will basically cut out so that when you exhale, that you don't have that facial pressure. That's what seems to really cause folks to want to take the mask off and put it aside.
So if you gave up on one of these, maybe you should go try again.
There is some new technology that is available.
While we show you the Baptist Health Helpline, I know you wanted to mention some people that helped you bring all this today.
Well, Tammy White from AeroCare in my hometown of Arkadelphia helped out, and then Chad DeGroot, who is with Respironics, he's out of Maumelle. And then Dr. David Davila is the sleep specialist at Baptist Health in the Baptist Health Sleep Disorders Clinic.
Yeah, if you have any questions about the Sleep Disorder Clinic or anything else at Baptist Health, call 1-888-BAPTIST and they can tell you exactly how it works. And KATV.com, of course, we'll link you to Baptist Health's website as well. Thank you so much.
You're welcome.
Hopefully people and their partners will be sleeping better if they can find some help.
I wear one like this myself, and my wife is very appreciative. She's getting sleep now at night.
I understand. We have one in our house, too. Thank you so much. Dr. Mark, good to see you again.
Good to see you.
Dr. Mark Jansen with Baptist Health.